we've, Diane's been making some phone calls to United Healthcare and a lot of texting and phone messaging going back, and we don't really have an answer for you yet on that, on whether that's permissible. And I know Diane wants to talk to you a little bit more about participation, so.
We would like a commitment that all the unions will try to, through programs, through whatever you want to do, increase participation by 10% in the Wellness Rewards program.
We have no problem taking it to our workshops. As a matter of fact, after being here today, talking about our next one before the workshop actually starts is the healthcare.
And if you need numbers from me, like I can give you numbers to compare us, I think that's a good thing to share with people.
Later, but, particularly the health insurance premiums and other.
I think that shows Diane's commitment to the program because it costs us money to more people to do it. But I feel like the benefit is there on the claim side down the road.
Yeah, we have no problem doing everything we can to try to promote, whether it's the benefits program or the telemedicine, whatever the things are that reduce costs out of pocket or for the district or promote wellness enrollment. We have no problem trying to do that. We can speak to you and see about setting up whether it's a quarterly seminar for our membership, and we put out information saying, do you have questions about this? Do you want to know more about how to save $600 a year? So we can start to market that internally, yeah.
Send out newsletters to your membership, maybe put articles in there about...
Put it on the website.
Yeah.
Definitely. It's amazing to me how people complain about the salary that they're receiving, and yet these percentages, first time I've ever seen them, of how many people do not participate, so do not get that $600 a year discount, but on the other side, or, open my eyes a little bit.
All right, so if we get that commitment from you, we will take your recommendation on the wellness. I don't want to put it in writing that we can do it if it's not legal. So I want to make sure that it's allowed. They think it is, but I want it better than I think it is allowed.
Just to be clear, it's a commitment to try to get 10% to increase, not a...
Oh, if you don't, you're in big trouble. Yes.
Make sure I understand what we're talking.
Yeah, it'll be a commitment to try to do things, maybe you can talk about it at every meeting that you have, things like that, and say, hey, we're trying to increase our numbers. We want to show good faith here, and we think that it brings, that it helps down the road. We were just talking about among ourselves, and the August 31st is the deadline, right, for people to get full rewards. And so we were talking about somebody that hasn't done it yet, and that they're afraid they're not going to pass, so they haven't done it yet, but they're thinking about it, and that's really what you want. So if you get your members to think about it, even if in the beginning it's only once a year, it makes a difference, because people don't like not passing that. And a lot of the people that won't do it, you don't see people that are in good shape say they're not going to do it, do you? They're all people that are afraid they're not going to pass, and they don't want it. They don't want to see it in their face, kind of, because they're not ready to face it, which I understand that. If you're not ready to make a change, you don't really want to know that you really should make a change.
But if we also show them that even if you don't pass, there are things that you can do that are relative to that Rally app, you really have to look at it. They're so easy to do so that you still get the credit for it. You may not have passed, but you're at least aware of where you need to be. So say if you missed it because of cholesterol, right? That, this weekend you're not having bacon and eggs. You're going to do something else. And these little minor changes over the course of the year will add up and do make a difference in your overall health. And if we show people how easy the missions are on Rally, and the telephonic coaching is now online, there are things you can do. The Real Appeal is a pretty cool program. If we start pushing some of these programs that they can then get credit for doing this work, they're still going to pass even though they technically didn't pass.
But it would also be interesting too, if you have membership, as you're working to try to increase the numbers, what are the barriers they're feeling? Because, those are the ways that, can we address some of that, so that there's less resistance. So it's kind of a twofold, trying to get the membership to participate, but also those who are not, why? You're going to have that population that you talked about that just, for whatever reason doesn't want to do, because their information's going to be there, but what are the other reasons?
Do you ever get, do giveaways when you're having meetings and things? If you start giving away things that are like a Fitbit, and then they can tie it to the app or something. Start thinking of, when you're serving food at meetings, try to put in the veggies and the fruits with them. Don't just do donuts.
Trying to ruin our meetings.
Oh, we
We
see
want
what you
people to
bring
come to
in.
these meetings.
We see what CTA brings to the table when we're negotiating. There's a whole line of chocolate on that side of the table.
Meetings at 6 o'clock, as much salad as you can eat. So it doesn't really sound really like a union meeting.
And we'll commit to, and I'll reach out to you on this. We can put out a survey to try to ask a couple questions to that effect. Is, do you participate? Have you always participated, or did you just start? Why not? Does your spouse? So we can come up with some questions to try to get that data, and we'll run them by you, because you might have a better idea how to craft those questions, but we can do that and send that to our
I
membership.
think the membership will maybe hear from you differently than they hear from us. You know what I mean? And so it helps when different voices. It's kind of like your mom telling you something, you don't listen, but if your friend tells you, you listen.
Right.
So,
So basically, we'll be talking to them about what they can do next year.
well, you want to do it. I would love increased participation immediately. So,
All right,
But we
so-
only have like 5 days.
Right, that's what I'm saying.
right.
Not going to happen.
But I mean, maybe you can start in September saying you still have time to get half, right?
Okay.
Right? Because they can do it through December. Now, think of this. With your 300 and 300 for employee and spouse, are we going to do half of that from,
For the June? Yeah, for the partial.
so that's going to be, for those that don't do it on time, if we can agree to that, it's going to be then 150 each if they do it in December. So it's just a little less incentive, but that's okay. We just put that in because I'm not a super big fan of the end of the year thing, but
A lot of the new hires coming in, there must be buzz around it because they're working to, I haven't gotten my ID card yet, and they say, well, it won't be effective till September, so you can't meet the August 31st. So they're looking at it when they're hired.
so that's good.
So it is good. The word's getting out to the new hires.
And I'll reach out to you too in these communications or this survey, to try to get some direct contacts at the district for if people have questions, because otherwise they're going to email me all these healthcare questions, and then I'm going to have to email them to you. And with the middleman, I enjoy giving direct contacts for district employees so that it goes straight to the source, the experts.
We're forward thinking already. We've got buttons that we'd love you to wear that says, ask me about health rewards. And then we put together a cute little card you can tuck away in your suit pocket that kind of gives you those details, and we'll add contact information as well. So that's something we want the unions and leadership to actually promote, face forward, that
Yeah,
this
we're
is
gonna
our
make you guys
culture we
do it.
want. So
Invite you to a meeting and
I'll give you a sample.
try to sell it to.
Okay.
So if you wear that counts towards your efforts to, the increase is 10%. We would appreciate that.
Wear it to the next board meeting. Thank you.
I put mine on every day. See that?
Thank you.
It's going to
Look at
clip to $600
Every day.
tonight.
Okay.
People can pull it off.
I got a picture of mine.
Okay, all right, thank you. Whole other realm of thinking there, Mike. So what we'll do is we'll get our information from United Healthcare, and we'll set up a meeting as soon as we possibly can, so we can let you know what we're hearing, whether we're allowed to do what you proposed or not.
And we're talking about this to be effective 2021 because people need time to know that they can do it. But we're still considering this a one-year contract. It's just that that part of it starts in 2021. But we need the ability to come back to the table next year, depending on how the health plan
Why?
runs.
You guys like to live on the razor's edge. We're at 99%. This is, we appreciate your help here today. And, we try to come to the table. We're all part of the same health plan. And it's not like that we're trying to come in and beat the employees out of every dollar we can. We're trying to we enjoy this streak, of 7 years and no premium increases as employees, and also being able to, just offer that to the whole workforce. And we feel we're proud of it because we don't see it happening in too many places, if anywhere. So I think that's why it makes it for challenging bargaining sometimes, because we're coming in trying to do kind of minimal tweaks to keep us on this path. And, if we can make this suggestion work today, hopefully make sure that doesn't cause any problems, and we should be getting closer to wrapping this up.
We appreciate that.
Thank you.
We're giving you a sheet here that just something that we added to the board item for the dental plan. So it looks like it's between 8.3, 8.2, and 10% discount for the employees on the new Humana premium. So take advantage of that. So that's going to the board this week, right? Or,
Oh, no, that passed on
oh, it went.
Wednesday.
It went to the board.
Yeah, last week.
Any questions?
I just had one answer before.
Yeah.
All right, so I think we're done. What we'll do is, I'll get with you guys and figure out the next date, and hopefully in the next couple weeks. Okay?
All right.
All right.
Thank you.
Yeah, can we talk to you?
Sure.
I want to talk to her too.
Like a late time, like after school.